Surgery. Thanks for calling back. I'd like to tell you about a consult. It is a 34-year-old male with 2-day history of right upper quadrant abdominal pain, nausea, vomiting and jaundice. The patient has dilated intra and extrahepatic bile ducts on ultrasound as well as stones within the gallbladder. The total bilirubin is 4.6 and the direct component is 3.1. I believe the patient would benefit from endoscopic retrograde cholangiogram. He is in room 324. Can you see him, and let us know what you think?
MRCP.
Well, I think the patient has stones within the common bile duct, and it would be better if we did one study that would both prove this clinical suspicion and be therapeutic as well.
MRCP.
Why do you think a MRCP is a better option?
MRCP.
Would you like to see him first and critically evaluate the patient's vitals, physical exam, labs and clinical picture, before rendering an opinion?
MRCP.
Isn't there an option other than MRCP?
Hepatobiliary scan.
Isn't a hepatobiliary scan inaccurate with total bilirubin greater than 4.0? And won't you agree that it won't alleviate the obstruction, and that it will only delay the intervention he needs?
You are right. If we do the hepatobiliary scan we will still need an MR100P.
Didn't you do a fellowship so that you could perform ERCP?
Yes, but we learned in my fellowship to delay ERCP with MRCP in my first month. It's the way I was trained. I never questioned my training.
So if the MRCP is positive then you will do an ERCP?
Possibly, but only if I can't delay long enough to force you into doing an intraoperative cholangiogram first.
I see.
I prefer to only do interventions that take less than 5 to 10 minutes and have very little risk such as upper endoscopy. I do these, even when they are not indicated, and even without seeing the patient, if they are ordered by a hospitalist.
I prefer only to do appropriate cost-effective workups and indicated procedures.
MRCP.
Stop saying that.
I get paid by the hospital $100 each time I say or write the letters MR100P 1000 or 100P.
Goodbye.
MRCP. Bye.